Hi everybody, Dr. Garcia from Garcia Facial Plastic Surgery. Today we're going to be talking about anesthesia and the different modalities that we have available for our patients. The first one I'm going to talk to you about is the deepest form of anesthetic that we provide, which is a general anesthetic. Now there's different types of general anesthetics and there's different ways to provide a general anesthetic. Typically in this practice we use either a IV anesthetic or a inhalational anesthetic, or an anesthetic that you breathe in. The main and the most important point of the general anesthetic is that patients are completely asleep for this procedure. They never have any recollection of the procedure and they don't wake up during the procedure. I've been doing this for almost 20 years now and I have never seen a patient wake up during anesthesia. I know that's a concern with a lot of patients during procedures, but I have yet to see that issue come up in this practice. Also, very importantly, patients do not remember anything that happened during their procedure, and they have essentially what is a block of amnesia in time where they just don't remember things. So for patients, it's a very quick and easy process. They stop remembering and then before they know it, they're awake again. We typically use general anesthetics for some of our larger surgical procedures, for example, the rhinoplasty procedure or nasal surgery procedure, the facelift procedures, and sometimes even the smaller procedures like blepharoplasties are typically done under a general anesthetic. So really it's customized to each patient and their concerns and their needs.
So the nitrous oxide, which is self-administering, is great for patients who feel a little bit nervous about certain procedures, such procedures like fillers or more local procedures such as blepharoplasties or lesion removals. We can also use it for Ultherapy. It's a great option because you don't need a driver. It's a rapid onset. As soon as you start inhalating, you can start feeling relaxed. And about 10 to 15 minutes after your last inhalation, then you are fully awake and able to drive home.
Okay. I think it's important. One of the things that she said to denote is that it is self-administered. In other words, there is a mouthpiece that the patient actually holds, and whenever the patient wants to go a little deeper with the laughing gas or the nitrous, all they have to do is take a few puffs through the mouthpiece, and then they go back to breathing normal room air until they wake up a little bit, and then again, if the anxiety starts to take over, they just take a few puffs of the anesthetic. So it's all self-controlled with the patients, and again, it's a very safe way to kind of get rid of anxiety with these smaller procedures, right?
We use a local anesthetic, which basically means we're injecting an area so that it is numb. And it's a great option for people who are nervous about going under general anesthesia because with a couple of injections, the area that we would work on, they're not able to feel it. It can be used for procedures like eyelid surgery. It can be used for our minimally invasive skin tightening procedures. And it's really great because doesn't cause any drowsiness or have any kind of side effects. It just really just numbs the area that we're working on, keeps patients nice and comfortable during their procedures. And the fillers that I use, the Juvederm line of products, they all contain lidocaine, which makes the injecting process much easier for all of the patients.
I think you brought up an interesting point, which is the fact that many times lidocaine is used for a lot of the procedures that we can also use the nitrous oxide on, and many times we combine both of those procedures, the local anesthetics and the nitrous oxide, to ensure that the patients are comfortable. Our primordial concern here is patient comfort. This is elective cosmetic surgery. We want to make sure that the patients have a relatively enjoyable experience that is pain-free, and so we go to great lengths to make sure that during any of our procedures our patients are comfortable. So thank you for watching. I wanted to bring out and discuss some of these different techniques that we provide here for anesthesia. And once again, thank you all very much for watching.